Good evening and welcome to Aging Matters, a program brought to you by the Berks County Area Agency on Aging. My name is Ann Barlet and I'm the Manager of Community Outreach and Education for the agency. Our program this evening will be focusing on veterans benefits, but particularly on health care issues and benefits with health care related concerns. My guest this evening is Dale Derr, the Director of Berks County Department of Veterans Affairs. And thank you for being with me tonight, Dale.
Thank you, Ann.
We have a lot to cover.
Yeah.
We met earlier and talked about some of the different benefits that you can receive as a veteran, and we decided that we could be here for days talking about all the benefits. So we are going to just focus on healthcare related. And what I would like to say right now, before we go into some specifics, is because we only have a certain amount of time tonight, please, folks, if you are a veteran or a family member of a veteran and want to know more about benefits in total as well as specific health care, I'm going to ask that you call the Veterans Affairs Office, and I believe we have the phone number that we can show on screen, and I'm going to ask that that be shown. The local office phone number is 610-378-5601. So please do that, and now we can get on with our show, and we'll mention that again later on toward the end of the program. So there's a lot to cover, Dale, in healthcare, and so let's get right in. I'm a veteran and I need healthcare. So how do I start? I mean, how do I let somebody know that, maybe I've moved to town, maybe I'm just looking for a regular doctor, or I need a specialist, or I need lab work or something else? I guess my big thing is how do I start? What is in our county? Where do I start? How do I begin?
That's right. One of the things that we would definitely want everybody in Berks County to know that with 29,000 veterans, we fall within the coverage area of the Lebanon VA Medical Center. We're one of 9 counties. So you have county government services through our office that you can get information from, and we can help you navigate the benefits. But we can also get you connected with the team at Lebanon. That team at Lebanon is considered one of the more outstanding teams out there for health care. And their coverage area is 9 Pennsylvania counties, including Berks County. But there's some things about where you live, where you have choices, you have options. You can maybe go into a medical center in another county easily from where you live. You don't have to just be served by the Lebanon VA Medical Center. But I would encourage all veterans in Berks County to consider VA health care. It's the largest integrated healthcare system in the United States, the largest healthcare system in the United States, with over 1,700 facilities. And we're fortunate in Berks County where we have options to use any one of 4 different medical centers. But our primary one, the one that supports veterans in Berks County, is the one at Lebanon VA Medical Center.
Okay, so if we would stay with that with a focus, what might I get there? We're calling a medical center, so do I go there for a regular doctor, my primary care physician? Must I go to Lebanon to be seen by a doctor through that VA system?
Yeah.
Can I go to another primary care doc but use the Lebanon VA Center for other services? Clarify that for us, if you will.
Yeah, each of the medical centers has a network of community-based outpatient clinics. These are primary care clinics. They often have diagnostic equipment. They'll have usually psychological services, and then they'll have drop-in services. But most people are seen by their primary care provider at one of these clinics. And we have one located at 6th and Walnut Streets here in Reading. It's part of the downtown campus of St. Joseph's Hospital, but it is a VA clinic. Now, as we understand things, St. Joseph's Hospital needs that space, and that has prompted that clinic to relocate soon out to Spring Township, near the Kohl's department store out there. And as we get closer to the opening of that clinic, we're going to push a lot of information into the community.
Okay, and that's a bus route as well out there?
It's on a BARTA bus route, yeah,
okay,
BARTA bus route. And if you have questions about transportation to and from your appointments, check in with us, talk to us, and we'll make sure that you get to your appointment.
So let me clarify, make sure I understand. So although we have the Lebanon VA, we can go to a clinic, whether it be before it moves is at 6th Street or out to the one near Kohl's. When it does move, we can go out there and we can have a regular primary care visit. What other, since it's a clinic, it sounds like there's other services. So what else can I get there if I'm a veteran? And then also, is it just for veterans, or can a family member of a veteran go to those clinics
Let's
as well?
start with that last part first.
Okay.
It's primarily for veterans. If a veteran is 100% disabled, the veteran may need for their family member, that veteran's family may need health insurance coverage. There's a program that the VA does sponsor and manage out of its Denver, Colorado office, but it does provide health insurance, and that means that the family members can go to providers in the community. But as far as the veteran enrolled into VA healthcare, that primary care provider is just like the family doctor. You get all referrals from that family doctor out to specialists. The medical centers have most of those needs already on staff, or they have contracted for providers to come on staff at the medical center, or they'll schedule the veteran to go out to a non-VA provider, usually under contract, or at least an authorization number. There's a brand new act that Congress just brought into law that's called the Choice Act, and that Choice Act, if somebody can't get their appointment scheduled in a reasonable amount of time, if they live outside 40-mile range from a facility or a provider, if they just have physical barriers to getting to their medical care, then the VA will authorize non-VA care for them. And sometimes that may be a Friday night visit to the emergency room at Reading Hospital. And the VA, the veteran has 72 hours for the veteran or a family member or a friend to call it in, and the VA may possibly pay for that emergency room visit. And if admitted, there's another 72 hours to make that call, and then they may be able to authorize that non-VA care. So they use partner hospitals throughout the communities in their 9-county coverage area to make sure that a veteran has access to the care that they need. There's been a lot in the news about places like Phoenix and North Carolina and Chicago where some veterans have passed away waiting for appointments. Well, I'm very happy to say that Lebanon VA Medical Center in its region is the #1 ranked medical center for overall for patient care and satisfaction, and that includes being able to get into appointments and such.
And so that's really nice that you were also able to clarify that because I, let's say, live in Reading, and if I have an emergency, I don't have to figure out, well, I can't get up to Lebanon, it's too far to go for an emergency, that there might be some of the agreements with the other providers to be able to go locally in an emergency and get that done. Okay.
And the emergency medical services in Berks County ordinarily won't transport out of county as a first priority. They need to go to the local emergency rooms and trauma centers. And so if there's a transfer to the VA through the emergency room or direct admission, that can all be coordinated between the VA hospital and the providing hospital. And to make that happen, just have to ask. Just have to make that call.
Make that call.
Make that call. When in doubt, make that call and make sure that your care is being authorized in a non-VA setting. Don't ever go out and get that care and then expect the VA to pay for it. It almost always fails when people do that.
Oh, that's good. Good to know. And let's go back to then the medical centers. So I go and I can see my primary care doctor. Will they also have things like lab work if I need lab, other services like that could you tell us a few other services that would be provided that could also be part of those benefits of going to those centers?
That's right. The medical centers have have full-up laboratories to do the test the blood draws and the bodily fluid samples and things like they do run through laboratories, and they'll do all that work for the patient. The blood draws may be done at the primary care clinic, but then sent off to the medical center for the laboratory testing, and those results are then provided back to a doctor, much as they're done at the Reading Hospital or St. Joseph's Hospital, and then those results are reported then to the patient, and there's good communication. One of the nice things I like about the telephone system that they have is when you call the number, and you might want to bring up the phone number for the Lebanon VA Medical Center. It's 1-800-409-8771. They only have 5 telephone extensions for a full-up medical center, and extension number 2 takes you to the appointments line. So that's how you book your appointments, you schedule them, and you can also leave a message for your provider. Oh. And so a lot of, in modern America, how do I talk to my doctor?
Exactly. Yeah.
Because the doctor is extremely busy. Yeah. And the PA, the physician assistant, the nurse practitioner, they're all so busy. But this is a great way to leave a message for the provider, and they do a really nice job of making sure that they get those messages acted on and the word gets back to the patient, the caller. And that's extension 2 when you call that 1-800-409-8771 telephone number. You can start with that phone number to ask your medical care questions. How do I get enrolled? If enrolled, what happens next? How do I schedule my appointments? What do I do with my billing questions? Because in some cases, veterans do have to pay copays. And if you're not qualified to the higher level priority groups, you may be asked to pay copays for prescription meds, your doctor's office visits. Well, that still may be very competitive with what you're paying with private practices. Okay. And especially prescriptions, the copay is up to $9 for a 30-day supply of medicines. Well, that 30-day supply of medicines ordinarily is going to be, in their formulary, is going to be generic medicines. They uncommonly prescribe brand name medicines. But a 30-day supply at a copay of $9, most veterans tell us that that is a very competitive copay. But they also tell us that Walmart Pharmacy and CVS and sometimes other programs out there can beat that. Well, okay, there are VA doctors who will write that script just for that.
And that's what I was going to ask. So again, I'd like to clear up maybe some misconceptions or things that we've heard, and you want to correct as far as must I go here or must I go there. So we were on to medications as far as getting the scripts for medications. So if I go to a center, VA center somewhere, have a primary doctor, the doctor writes scripts, I do have that option then, knowing what the cost might be of getting it through, is it through the VA or through another drugstore pharmacy?
That's right.
Okay.
But you can't expect to bring in your private doctor's prescription to a VA pharmacy. Okay. You actually have to get it verified by your primary care provider, and then that script is then recognized by the VA if you want the VA to provide that medicine. It works out really well. You can carry your own private provider. Okay. Some of your viewers may be with that provider for 50 years. Exactly. And they're very happy that way. They can keep that provider and enroll into VA healthcare, and then they may be able to take that prescription and show it to their VA primary care provider, and they may authorize that same medicine or maybe a generic equivalent. But if, and many folks tell us that they're very concerned about the cost of prescription medicines, and some want to enroll just for prescription medicines. You can't just do that. You have to see a primary care provider within the VA healthcare network.
Good. I'm glad you clarified that. I think that's good to know. I hope we all got that. And so let me also ask you this. So I can't just stroll in and say, hi, I'm a veteran. I need some form, folks that are older and are on Medicare, we have the Medicare card. So what does the veteran show?
Yeah, once enrolled into VA healthcare, the veteran will be issued a patient ID card. Because it's such a large healthcare network, as you come to a laboratory for a blood draw or to a therapy clinic or something like that, you identify yourself with that card. And to check in at a medical center today, you also come up, as you enter, you come up to kiosks and you just swipe that card, and you may have 4 appointments in that medical center that day, and immediately they know that you're in the building and that your appointment is pretty well locked in. But it also, if they have cancellations in a clinic, they may contact your clinic that you're visiting right there and say, hey, send him up earlier, send her up earlier. We're ready to take them because of a cancellation or just moving quicker through their day than they anticipated.
Sounds like an efficient system.
It is working very well at Lebanon VA Medical Center. We're real proud of the collaboration, I think, and the communication between county veteran services officers like me and from the director on down. I can contact the chief of staff and ask for him to intervene on behalf of a patient because of just what usually turns out to be miscommunication between the patient and the provider, and that's just coordination. And the chief of staff I don't have to know all the doctors, but I can work through the key people, and I may be able to get those things sorted out for the patients, and that works out pretty well.
And I think we do have a graphic to show of a copy of the ID, if we can get that on, so folks can see what that looks like and know what they're looking for.
Oh, we don't have that.
Do we not have it? No? Oh,
right.
okay. Well, they can call your office.
Yeah.
Okay.
But we definitely want you to know that that enrollment doesn't have to, you don't have to give up your private provider.
Okay.
You can continue to carry that private provider. You're even encouraged to continue with your private health insurance and your Medicare if you are in an emergency while traveling and you have to go to a private hospital. Well, maybe, just maybe, you may be on the hook to pay for it yourself, and in those instances, then you have that coverage. Unless you're into the highest priority group within the VA, would I think that you might want to give up your private health insurance and your Medicare, but that's not that common that people do that.
And we talked a little bit about medications. Let's also address, and we talked about lab services. How about some of the, I'll call them ancillary services that folks, as we get older, need? Vision, perhaps, so glasses, perhaps hearing aids, dentures, dental care. How about those kind of services through the VA? Available, not available?
Yeah.
Maybe, maybe not.
October of last year, the VA started a dental insurance program with 2 providers, Delta Dental and MetLife, and for really good premiums, you can get access to dental insurance. Where for some folks in America, they have no access to dental care. And this is a great way to do that. Because in the VA healthcare network, you don't necessarily have access to dental care unless you have military damage caused damage to your teeth, your jaw, your tongue, your palate, then you would get access to it. But not always do all veterans get access to dental clinics. For eyeglasses, similarly, you have to have military-caused damage to your eyes, your eyesight, to qualify to use an optometrist with the VA or an ophthalmologist and get eyeglasses. So this is something that we want to talk with you about as far as your needs and how you might qualify for that care. And then probably the most commonly asked for question after prescription medicines is hearing aids. The most commonly claimed for disability for compensation purposes is hearing loss in military service and ringing in the ears as well. And with that being such a commonly asked for question, that's a good that's a good reason for why you should enroll into VA healthcare. There's two ways to obtain hearing aids. One is enroll, talk to your primary care provider, and get that referral to audiology that may work for you. Another way is to work with folks like us and we help you with a claim for disability compensation for something like for hearing loss in this case, and then you would you may qualify for hearing aids to help you. There may be other ways to help you, but if your audiologist recommends hearing aids, the VA may cover the initial set, your supplies, replacements. That's really a tremendous value. And it's mostly spouses who are the ones who finally tell their military veteran spouses, it's time to enroll in VA healthcare and go see the audiologist. And that's how quite often this connection that we get, it can be somebody who's in their 70s, 80s, and even 90s, and we can help them enroll.
And just enroll at that time because of that.
Hearing aids is usually, hearing aids or prescription medicines are usually the motivations behind their enrollment later in life.
Sure, and obviously the hearing aids and dental and things can be quite expensive. So, real quick, also in the little bit time, I wanted to talk about, we mentioned earlier about that the downtown clinic center is going to be moving in, talking about a bus route, but I want to go to the Lebanon VA. And I really don't feel comfortable maybe driving that distance or can't drive the distance. How do I get there? Is there, I know we talked a little bit about, so I understand there's a transportation system. Can you just give us a brief thing on that?
Why don't you bring up the transportation phone number?
Okay.
We in Berks County have a tremendous benefit with 4 volunteer services that are out there, but you can call and get the access to these volunteers who will pick you up and drive you to your appointment at Lebanon and get you home safely that same day. What they ordinarily ask is that you try to give them about 2 weeks notice on for a ride, and they ask that you ordinarily schedule your appointments in the morning, and then if you do need to cancel, you call and let your provider, your driver team know that you need to call off from that appointment. Don't forget them. This is a nice thing. You do have to be able to get in and out of the vehicle independently. Okay. If you can't and need the assistance of someone else, usually they'll allow you to travel with another person. But you have to let your scheduler know that a second person will be traveling, because they may book that seat otherwise to a veteran. But this is nice. Not all counties have this volunteer network that's out there, and it is important for folks to be able to get to and from their appointments. Some folks have therapies 3 times a month. Well, that's a lot of rides, but we have 300 riders in our database. The Red Cross has almost 600 riders in their database. There are a lot of folks in Berks County who just don't have transportation anymore to be able to, or independence enough to be able to get to and from their medical appointments.
Okay. We have only a couple minutes left, Dale, so I just want to ask this question. Do any of these health care benefits pass along to any other family members?
Not really, no.
Okay.
No, we just don't.
Pretty much honoring the veteran. Okay. And a couple other things real quick in terms of touch on long-term care, in that maybe assistance at all with home health care, and or as life progresses into hospice care at all. Any of those services available?
Yes, palliative care for pain management and throughout the patient's treatment, and then also hospice care. Hospice is a national center of excellence through this network to really maintain the dignity of life through the remaining time alive, and a high degree of satisfaction from the patients while they're going through this, and then also the family members, and it's a good thing.
Good. All righty. And we know that there are some other benefits in terms of long-term care. Might be an aid and attendance should somebody need home care, whether in the home or in a location like a personal care. I know it's a lot of eligibility criteria and whatnot that, again, we could be here another several hours talking about that in particular. But we've covered, I think, a great deal this evening on some of the basics on the health care benefits. I hope we've managed to clear up some misconceptions out there. In the 30 seconds, Dale, do you have any last words for us at all before we show again the number in the book?
Well, we would love to have a veteran and spouse or caregivers, professionals, to come out to our Tuesday afternoon benefits presentations at our office at 726 Cherry Street. It starts at 1:30 on Tuesdays, lasts about 2 hours. Free parking in the garage beneath the Barlet bus station, and we'd love to have you.
Great. And I have one more thing. I would like, if we can show this book, there's a book available that talks about healthcare benefits that you can get when you visit the local Veterans Affairs office. Again, that number to call is 610-378-5601. And in the last 10 seconds, Dale, I understand it's not too late for the dinner dance. I think do we have the graphic for the dinner dance real quick?
Yeah, we can close with that one.
Okay, there it is. Go ahead,
not
Dale.
too late to get your tickets. We'd love to have you come out Saturday night, 4 o'clock at Wilson High School's gymnasium. Veterans, wear your medals. I'd love to have you come out for good food, good music, and we have some special program I think you'll enjoy.
Good. Well, thank you very much. I'm glad everybody could tune in this evening. Thank you again, Dale, for being with us. Please call the Berks County Department of Veterans Affairs for more information. Thanks.